Please be seated. Recognize the Honorable Minister for Finance.
Thank you, Madam Speaker. Madam Speaker, I would like to make a statement in response to the letter dated the 3rd of May, 2016, issued by Mr. James Watler, President of the Cayman Islands Civil Service Association, or CICSA, on the issue of co-pay of health insurance premiums by civil servants, and to provide information on health care costs borne by the government. Madam Speaker, I would like to thank Mr. Watler for responding promptly to the very important issue of the government's rising health care costs, an issue that is important to both civil servants and the government alike. Madam Speaker, on 15 May 2015, the Honorable Premier, in his policy statement on the 2015-16 budget, acknowledged that good governance means the government owning up to and taking steps to deal with the intractable problem that plagues governments, such as the burgeoning government health care costs. In my 2015-16 budget address, which I also presented on the 15th of May 2015, I expounded on the Honorable Premier's statement where I referenced the Ernst & Young report, where it was recommended that we should introduce co-pay and deductibles for all Cineco customers. Madam Speaker, I went on to state in my 2015-16 budget address, and I quote, Madam Speaker, "Given that the majority of Cineco customers are civil servants and healthcare benefits are part of their contractual terms and conditions of service, we will request the Deputy Governor and Head of the Civil Service to present a business case to Cabinet on the feasibility of this recommendation and potential impacts on the civil service, civil servants, Cineco, and the Health Services Authority." The Deputy Governor, in his contribution to the 2015-16 budget debate, also stated that as the head of the civil service, he would be asking the portfolio of the civil service to review the terms and conditions of civil servants, including a proposal to introduce cost sharing for health care by 2018. Madam Speaker, the government has an obligation to pursue policy actions which address rising cost drivers where such costs are a significant element of its annual operating expenditures. Madam Speaker, healthcare costs is the latest such issue facing our country, according to the Mercer Actuarial Report, the Auditor General's Audit Report, and the Ernst & Young Report. Madam Speaker, the below table and charts indicate that the government's budgeted healthcare costs have risen steadily in the last 5 years. However, the actual healthcare cost is even higher than the budgeted cost because of the unpredictable nature of the NGS 55 output that will usually exceed the budgeted amount. Therefore, the healthcare costs as a percentage of operating expenses would be even higher than the numbers shown in the table, but time did not allow me to get to the actual expenditure for these categories. And Madam Speaker, we can see from the table that the budgeted operating expenses for the government in fiscal year 2011-2012 was 524 million CI dollars. Budgeted healthcare costs were 87 million CI dollars. Budgeted healthcare costs as a percentage of budgeted operating expenses was 16.6%. For the fiscal year 2012-2013, budgeted operating expenses was 569 million. Budgeted healthcare costs had risen to $102 million. Budgeted healthcare costs as a percentage of budgeted operating expenses increased from 16.6 to 17.9%. In fiscal year 2013-2014, budgeted operating expenses were 549 million. Budgeted healthcare costs were 106 million, and budgeted healthcare costs as a percent of budgeted operating expenses increased from 17.9 the previous year to 19.2%. Madam Speaker, in fiscal year 2014-2015, budgeted operating expenses were 537 million. Budgeted healthcare costs were 104 million. Budgeted healthcare costs as a percentage of budgeted operating expenses increased from 19.2% in the previous year to 19.4%, Madam Speaker. And in fiscal year 2015-2016, budgeted operating expenses increased to $553 million. Budgeted healthcare costs increased to 107 million. Budgeted healthcare costs as a percentage of budgeted operating expenses stood at $19.3 million, Madam Speaker. So despite operating expenditure increasing, the percentage healthcare costs as a percentage of the overall budget still remained at 19.3%, Madam Speaker. And therefore, we can see there, Madam Speaker, that while operating expenses fluctuate, budgeted healthcare costs and budgeted healthcare costs as a percentage of budgeted operating expenses are on an upward trajectory. In fiscal year 2011-2012, sorry, Madam Speaker, I've already covered that. So, Madam Speaker, there is no doubt that healthcare costs are significant and increasing annually. In addition to fully funding healthcare costs for civil servants, pensioners, seafarers, and veterans, the government offers loans to underinsured and uninsured persons who seek medical care overseas. As at the 4th of May 2016, there were 345 outstanding overseas medical loans with unpaid balances totaling CI 12.3 million owed to the Cayman Islands government. The Mercer Actuarial Valuation Report shows that in June 2014, the country had a post-retirement health care liability of approximately CI 1.18 billion Cayman Islands dollars. This is the present value of this amount over the next 20 years. Unless health care costs are addressed, this liability will only increase with time. Madam Speaker, in 2009, when the government issued the US $312 million bond, the government disclosed in the offering memorandum for the bond issue that the health care liability was approximately CI $654 million or US $798 million as at July 2004. Therefore, it is clear that the health care liability has doubled or grown by 100% in 10 years and is growing by approximately 50 million per year. Madam Speaker, the numbers in the above table represent an estimate of the annual health care costs incurred and expensed. These estimates do not reflect any accounting for future post-retirement health care costs. However, if the future post-retirement health care liability was recognized and expensed every fiscal year, the increase in the annual expenditure would be significantly more than shown in the above table. Madam Speaker, the government recognized the gravity and significance of the health care cost liability facing the country and the struggles it presented in preparing the budget annually. Prior to the government's recognition of this issue, the former minister responsible for overseas territories, the Honorable Mark Simmons, in June 2013, when the Premier, myself, and the Financial Secretary traveled to the UK for the 2013-14 budget, the minister stressed his concerns about the size of the civil service and the related costs and liabilities and queried what did the government intend to do about it. In preparing the 2014-15 budget, the government faced the same dilemma. On the 11th of March 2014, the Financial Secretary, the former Chief Officer for the Ministry of Finance, and myself met with the Cayman Islands Civil Service Association Management Council to apprise them of the UK's concerns and the government's dilemma. At that meeting, it was stated by Management Council members that in exchange for co-pay, civil servants would want freedom to choose healthcare providers. We received a letter dated 24th March 2014 from the CISCA President, Mr. Watler, referring to our discussion and the issue of co-pay with choice and requesting that the issue be discussed with the Deputy Governor, the Portfolio of the Civil Service, and the Ministry of Health. Madam Speaker, in July 2014, as Minister for Finance and Economic Development, along with the then Minister for Health, the Honorable Osborne Bodden, formed the Healthcare Cost Reduction Committee to review the issues that were driving the government's healthcare costs and to make recommendations on how the government could reduce those costs. The committee met 4 times between July and December 2014. And Madam Speaker, members will remember that last week I mentioned the various agencies that were involved or represented on that committee, and I subsequently provided the names of the members from each agency. Madam Speaker, the committee's report, inclusive of its recommendations on healthcare reductions, was presented to caucus on the 9th of February 2015 and again on the 2nd of November 2015 and accepted by Cabinet on the 12th of January 2016. Cabinet's approval also included the instruction of the Healthcare Liability Reform Working Committee to prepare and deliver to Cabinet by the 31st of March 2016 an outline business case for the recommendation on co-pay for civil servants. Madam Speaker, the preparation of an outline business case involves extensive analysis and appraisals as it relates to economic and qualitative benefits and risk, and consultation with stakeholders, which include civil servants and CISCA. Madam Speaker, as decided above by Cabinet, the portfolio of the civil service has been meeting with the CISCA Management Council over the last 4 months to agree on the details as to how co-pay with choice would be implemented, meaning who would contribute based on ability and how much they would contribute. That is, Madam Speaker, what percentage of the premium. Madam Speaker, in addition to co-pay, the government has already delivered to this honorable House 2 bills, Madam Speaker, that should read in addition to co-pay as a means of addressing the healthcare liability. In addition to co-pay, the government has already delivered to this honorable House 2 bills to amend the Public Service Management Law and the Public Service Pensions Law to increase the retirement age from 60 to 65. These bills will be debated in the next session of this honorable House. And Madam Speaker, the proposed increase in the retirement age will benefit civil servants in numerous ways, such as allowing willing and able civil servants to earn a higher salary as compared to a pension, being able to negotiate lower mortgage payments with more years to repay their mortgages, and the accompanying mental and physical health benefits of working and remaining active for a longer period of time, in line with the National Pensions Amendment Bill. Further, Madam Speaker, the government is also considering the feasibility of the following measures. Number 1, capping the lifetime limits on claims. Madam Speaker, presently, every civil servant enjoys a lifetime maximum on health insurance claims of $5 million. Very few actually reach that limit, but the fact that it exists, Madam Speaker, the 5 million cap, the fact that the 5 million cap exists results in a potential liability that is quite high. The government will therefore propose to lower that limit to a more realistic figure, which will also limit government's potential future liability. For the sake of comparison, Madam Speaker, private sector employees usually have a lifetime maximum of $2 million, and that is for the very senior employees and partners of professional firms. Number 2, introduction of a graduated post-retirement benefit scheme. It is possible, Madam Speaker, for someone to spend 30+ years of their working career in the private sector, then join the government and retire after 10 years with the same full coverage of lifetime free medical as someone who has worked their entire career in the civil service. This is the present regime, which should be re-examined, as this also impacts the post-retirement healthcare liability that the government now faces. Madam Speaker, On the 3rd of May 2016, the letter from the President of the Cayman Islands Civil Service Association stated that healthcare costs of civil servants, pensioners, and indigents are conflated. Madam Speaker, this is not the case. Health insurance premiums paid to Cineco for civil servants and pensioners are separate and different than other categories insured by the government. Moreover, there are 4 different premium rates for civil servants depending on their marital status and whether they have children. Similarly, there are 4 different premium rates for pensioners. Madam Speaker, the below tables indicate that Cineco's monthly health insurance actuarial premium rates have risen steadily in the last 5 years for civil servants, pensioners, and seafarers and veterans. Madam Speaker, the actuarial rates for 2011-2012 fiscal year for a single civil servant is $394. Per month, Madam Speaker, per month, $394 per month. For a single plus spouse, it is $788 per month. And for a single with children, it is again $788 per month. And Madam Speaker, for a family, the premium, the actuarial premium, is $1,180. And Madam Speaker, those figures continue to increase every year. For 2012-13, I'll read them just going down the categories: 416, 832, 832, 1,242. For 2013-14, single, $438 per month. Married without children, $876 per month. Married, single with children, $876 per month. And a family, $1,361 per month. And those figures increase again, Madam Speaker. Sorry, correction, Madam Speaker. Those actuarial rates decline at that stage to $1,314 for a family and $1,317 for a family in 14-15 and 15-16 respectively. Madam Speaker, there are other rates there for pensioners and veterans that is evident to everyone who has this paper before them. So, Madam Speaker, over the past 5 years, monthly health insurance actuarial premiums, or the premium rates, have risen by 10% for civil servants and seafarers and veterans, and by 16% for pensioners, Madam Speaker. Madam Speaker, the actual premium rates paid by the government to Cineco are different than the above actuarially recommended premium rates. Madam Speaker, the considerations that I have outlined thus far indicate that copay is one means of helping to reduce the healthcare liability and costs borne by the government, but that in itself will not entirely address the significant healthcare liability and costs faced by government. Furthermore, in discussions with Cisco Management Council in March 2014, relating to the FCO's concerns about the size and cost of the civil service, co-pay with choice was raised in the meeting as a possible way of reducing some costs faced by government. I repeat, Madam Speaker, that in May 2015, during the budget address and debates, the Honorable Premier spoke to the growing healthcare costs. I spoke to the options available to address the growing healthcare costs starting 2018, and the Deputy Governor also stated that they would be holding discussions with the CISCA and the civil service with respect to their terms of employment in an effort to address the growing healthcare liability starting 2018. The exercise of reducing healthcare costs has now been placed under the Project Future regime, which involves further consultation, including discussions with CISCA. For several years, Madam Speaker, spanning several administrations, the issue of co-pay with choice has been discussed with the civil service, and it is pretty much accepted that the implementation of co-pay should come with choice of healthcare services provider. What remains to be agreed, Madam Speaker, are the details of who will contribute and how much the contribution will be. That is precisely what was meant by those remarks on the 28th of April 2016 when I said that it is pretty much accepted that there will be a move to co-pay with choice. The government and other legislators have accepted that something needs to be done, and there are many civil servants who are not opposed to co-pay, but simply want freedom of choice since they are already paying for private health care costs out of pocket instead of going to the Health Services Authority. Madam Speaker, it is encouraging to know that the CISCA stands ready to continue discussions with those responsible for the discussions, as we are aware that discussions have been ongoing for several months around this very important aspect of healthcare cost reductions. Madam Speaker, the government has made great strides to control expenditure and to ensure that the FCO did not insist that we cut jobs to reduce costs. However, Madam Speaker, the truth is there are very few places to cut in order to control costs or expenditure without adversely affecting the quality of services provided. Every day, there are growing demands for new services and additional civil servants to provide those services. Every day, there are growing demands for new services and additional civil servants to provide those services. Essential services such as education, national security, and health care are underfunded because of the health care costs and the long-term health care liability, Madam Speaker. Madam Speaker, I trust that this statement has clarified what was intended by co-pay with choice has been pretty much accepted, and what remains to be agreed is who will contribute and how much they will contribute. Thank you, Madam Speaker.
We'll now take the luncheon break and reconvene at 2 p.m.